Hello, everyone. This is Dr. O, and I'd like to bring you a presentation from NAMI. NAMI is the National Alliance on Mental Illness. Today, we will focus our attention on schizoaffective disorder. Once again, I'm Dr. O. I'm from the organization Human Service Consultants. So, I will begin by telling you that the schizoaffective disorder is a chronic mental health condition. It's characterized by symptoms of schizophrenia. These symptoms include hallucinations or delusions. But what makes it different from schizophrenia is that there's also symptoms of a mood disorder present. And these symptoms include mania and depression. Now, some people have been misdiagnosed. They have been diagnosed with bipolar disorder or schizophrenia when actually they have schizoaffective disorder. Once again, schizoaffective disorder is characterized by hallucinations, delusions, mania, and or depression. So basically, with the schizoaffective disorder, about 3% of the population, both men and women, experience schizoaffective disorder. Although it's experienced at the same rate, men often develop the illness at an earlier age. So I am going to talk to you now about some of the symptoms. Now, the symptoms fall in the category of hallucination, delusions, disordered thinking, depressed mood, manic behavior. The causes of schizoaffective disorder is unknown. There's a combination of causes that may contribute to its development. Basically, what must be considered is that schizoaffective disorder tends to run in families, so it's genetic. Also, consider the fact that brain chemistry and structure have an impact on schizoaffective disorder. So the brain function and structure may be different in ways that science is only beginning to understand. Brain scans are helping to advance research in this area. Also, it can be brought on by stress. Stressful events such as death in the family, end of a marriage, loss of a job can trigger symptoms or an onset of the illness. Drug use. Psychoactive drugs such as LSD have been linked to the development of schizoaffective disorder. Schizoaffective disorder can be very difficult to diagnose because it has symptoms of both schizophrenia and depression or bipolar disorder. So, to be diagnosed with schizoaffective disorder, a person must have the following symptoms. For bipolar type, hallucinations or delusions must be present for at least 2 weeks without an episode of depression or mania. A major depressive episode, even a significant lack of interest or pleasure, is not enough. Episodes of depression or mania are present for the majority of the time of the illness. There must be social impairment that inhibits functioning on a regular basis. Symptoms that cannot be explained by drug use or another medical condition would also be considered. The treatment is what we will talk about now. People with schizoaffective disorder are treated with a combination of medications and psychotherapy. How well does treatment work depends on the type of schizoaffective disorder, its severity, and its duration. Some of the medications include antipsychotic medication, antidepressant medication, and mood stabilizers. What the antipsychotic medications can do is help to relieve the symptoms of psychoses, such as delusions and hallucinations. What the antidepressant medication can do is alleviate feelings of sadness, despair, and trouble concentrating. What the mood stabilizers can do is help to stabilize the highs and the lows that's associated with the bipolar disorder. As far as psychotherapy, what do? What we do is we utilize cognitive behavioral therapy. We want to change negative thinking and behavior associated with feelings of depression. The goal of this type of therapy is to recognize the negative thoughts and to teach coping strategies. With conditions like schizoaffective disorder that have symptoms of psychoses, additional cognitive therapy is added to CBT. So the CBTP is utilized to help people to develop coping strategies for persistent symptoms that do not respond to medication. And finally, ECT, electroconvulsive treatment, can be utilized for some forms of schizoaffective disorder. So where medication and psychotherapy do not work with the schizoaffective disorder, ECT may be worth considering. In this particular type of therapeutic approach, ECT involves transmitting short electrical impulses into the brain. Also, ECT is highly effective treatment for severe depression. It is not the first choice in treating schizoaffective disorder. Once again, this information comes to you from NAMI. Dr. Taylor did not create the presentation, but she knows of this organization. This organization has support groups that's available to anyone who want to join online. And when COVID is over, they will have face-to-face sessions again. It's a good organization. It provides you with a wealth of information, and it is a fantastic support system. Please consider NAMI. And if you need any help, and there's no therapist available because she may be resting. I'm talking about me because everybody knows I work hard, right? Okay, so if I am unavailable, you can call 1-800-950-6264. This is the helpline where there are clinicians available. I want to thank you for spending time with me. Please review this presentation over again if need be. I am Dr. O from Human Service Consultants. I always want to wish you the best day ever. Be blessed. I want you to take the time to show love and to receive it. So in ending this presentation, you know what I am going to say. Love always. And until we meet again, take care of yourselves. Bye-bye.